We asked the question whether or not mothers that were vaccinated with the SARS-CoV vaccine, whether or not they could produce antibodies within their breast milk that potentially could be passed on to the baby. When babies are born, they don't have a very well-developed immune system. So what moms do is they pass immunity from themselves that they've actively made to the baby. And this is generally done by breast milk. And in fact, many vaccines are commonly given to mothers to provide that protection for the baby.
I am a physician in training in the neonatology field. Also, I'm a breastfeeding mother. So I had questions regarding the vaccine efficacy and possibly transfer of antibodies through my breast milk into my infant. And there is no vaccination allowed for kids below 12 years old, so I was concerned if my baby was gonna be exposed to the virus, if by any chance I could protect it with my breast milk.
So our study focused on lactating mothers that received the vaccine, and most of them were in the healthcare profession. So there were 22 that we started out with, and we took samples at 3 time points. We took samples before they were vaccinated, shortly after they received their first vaccine dose, and then shortly after they received their second vaccine dose. What we saw was that moms, as they received the first dose, we could see the antibodies being detected. But once they received that second vaccination dose, those numbers were much higher.
Going from seeing a pre-vaccination sample where there's nothing there to seeing after the first dose saying, oh my gosh, we're seeing a change here, and then after the second dose seeing a 100-fold increase in antibodies, I think that was really exciting.
It just reminded me how important it was for us to receive the first and the second vaccine, because that second dose really made a big difference.
Definitely, these are wonderful news, and I'm very excited to have been part of this study and being able to collaborate and help decrease the misunderstanding and the uncertainty that vaccination can create, especially a new vaccine that we didn't have answers before. But now, thankfully, we are getting some answers, some good news.